I thought motherhood would be the happiest time of my life. But the truth is, it's nearly destroyed me. I felt I was drowning in the sea of despair. And I could not even find my lifeline. I could not even find my path. I was suffering from postpartum depression. And I did not even know about it. This is my story. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, we are going to be talking about postpartum depression, which is one of the dark side of motherhood, and I'm going to be sharing with you a story. I am a first-time mom, and not for once did I thought I was going to battle with postpartum depression. But unfortunately, I did. After the birth of my child, I only felt the joy of motherhood for just few seconds. And afterwards, the rest were filled with worries and loss of interest. When I mean loss of interest, I mean loss of interest in everything, including the things I usually have interest in. After the birth of my child, there was this feeling of guilt I could not even explain. I could not even breastfeed the little child. I could not even breastfeed the baby. I get upset. I get worried with the sight of my baby. Before you know it, minutes became a day. A day was running into days. Days was running into weeks. And weeks was running into months. I was still depressed and I don't want to see my baby. Thankfully, my husband understood that something was wrong. And what my husband did was to send a message to Nurses Lecture Room, and she advised us to seek help from the hospital, which we actually did. And we were able to get treatment, which include counseling and drugs inclusive. And most importantly, I took my self-care very important. Self-care very important. And as God could have it, I was able to bounce back to normal and I was able to take care of my child. So if you are in this shoe, if you are battling with postpartum depression, I just want to let you know that you are not alone in this. There are a lot of women out there that are battling with postpartum depression. And this postpartum depression might be as a result of a drop in some certain hormone in your body due to childbirth. So if you are a man and you're noticing these signs I'm going to be listening today, or you are a woman and you know you're experiencing these signs I'm going to be listing today, it's advisable you seek help as soon as possible. With postpartum depression, the woman is likely to feel sad, is likely to feel worthless, hopeless, guilty of things she cannot even explain. This woman finds it difficult to sleep. There is loss of appetite. She is no longer hungry. She doesn't want to eat. And also, this woman finds it difficult to actually focus on certain things. This woman worry excessively about things that she would normally not worry about. And also, you see this woman finding it difficult to sleep, crying herself to bed, or crying for no reasons. These are the signs of postpartum depression. And most dangerously, this woman does not have any interest in the child that she gave birth to. This woman does not have any interest in the child that she carried for 9 months. So, as a man, when you see this sign in your woman, this is not a time for you to start shouting and say, this is your responsibility to do that. You are a woman. Yourself. No, this is the time for you to help your woman or your wife seek help as soon as possible. And this help could be counseling and also could be medications. It is time to talk about the risk factor for postpartum depression. And the first one I have to share with you is family history. If there is any family history of depression, postpartum depression, or premenstrual dysphoric disorder, that can put you at risk for coming down with postpartum depression. And the second one I have to share with you is marital issues. If you're having marital issues, you are always having issues with your partner, you were physically, emotionally abused by your partner, that can result in postpartum depression. That can put you at risk of postpartum depression. Then the third one I have to share with you is limited social support. If you don't get the necessary support needed by friends and family during this period, that can make you feel hopeless, that can make you feel sad, that can make you feel you're not good enough. That's why you're not getting the necessary support. That might also put you at risk for postpartum depression. Then the fourth one I have to share with you is complications in pregnancy. Complications in pregnancy can occur in different form. It can be as a result of preterm babies. It can be, oh, you had gestational diabetes, or there was hypertension in pregnancy, or you battled a lot. You didn't have a good experience during that pregnancy period. That might put you at risk of postpartum depression. And another I want to share with you is single parenting. If the baby comes into the world and the father is not there for you, you are just alone, you are the one giving the child full support, that is also something that can put you at risk for postpartum depression. And when a mother gives birth to a child with special needs, you know, the joy of every mother is to welcome the child with no complications or things like that. But when a mother gives birth to a child with special need, the mother might feel sad, might be start thinking of, oh, how do I cope? How do I take care of this precious child? Will I be able to cope? Will I be able to be there for this child? That might put you at risk for postpartum depression. So these are the things I want you to take note of when it comes to the risk factor. Then that takes me to the treatment before I go to the prevention. When it comes to the treatment of postpartum depression, it varies. It varies. The treatment for postpartum depression varies. It ranges from counseling, psychotherapy, some drugs being given, some anti-anxiolytic drugs, which as anti-anxiety or anti-depression drugs, might be prescribed by the doctors, depending on the severity of this postpartum depression. This postpartum depression might be mild, might be moderate, or might be severe. So the severity of postpartum depression actually determines the type of treatment that will be given to you during this period. So the question is, Nurse Miss Mary, can postpartum depression be prevented? Yes, you can try everything within your power to prevent it, but that doesn't mean that when you experience it, you should not seek help. That doesn't mean that when you experience it, you are not strong enough. So before we go, let's talk about ways that we can prevent postpartum depression. One of the ways we can prevent postpartum depression is to reduce our expectations from ourselves after delivery, and also expectations from the baby which we have given birth to. Yes, sometimes a woman like, oh, when I give birth to my child, I just want to be slim. Like, you just want this perfect body. You just want this perfect mother. You just want to be a perfect mother. No, you can't be perfect. But whatsoever you are doing for your child, I know it is the best. So reduce the expectation from yourself as a mother, and also reduce the expectation from your baby as they grow. That's going to go a long way to help you prevent postpartum depression. Then the second one I have to share with you is always seek help. Yes, you can't do it alone. When you feel it's getting overwhelming, it's getting tiring, it's getting annoying, make sure you speak out, make sure you seek help as soon as possible. When it is mild, when it is moderate, seek help before it becomes severe, because it becomes more serious. Then the third one I have to share with you is that you might limit visitors that are coming in immediately you just give birth. Okay, you might say, okay, I don't want too much visitors, or you might say, okay, I need a lot of help during this period. Whatsoever you feel is beneficial to you at that particular moment, I think that is what you should do. Then another is exercise your body. Exercise is a good way of balancing the hormones in your body. Exercise is a good way of releasing that good energy within you. So try as much as possible as a mother to exercise. But one of the things I feel actually results in postpartum depression is that we expect too much from ourselves and also from our babies. So when we limit the expectation from ourselves, when we limit the expectation from our babies, that is going to go a long way to help. So as mothers, when you give birth to a child, there's this feeling of guilt that you're not doing enough for your child. You start comparing your child, your newborn baby, to other babies. You start comparing your babies. You feel you have not done enough. You feel you made a mistake. You feel you are the one to be blamed. No. So reduce those expectations. Do the little you can. For every mothers out there, I just want to let you know that you are trying. You are doing your best. Stay around people with positive energy. Stay around people with positive vibe. Anybody that's going to give you negative energy during that period, stay away from them. Okay? Because negative energy, negative criticism, destructive criticism around you might result in postpartum depression. In all, the good news is that postpartum depression can be treated. Yes, it can be treated, so you have nothing to worry about. So once you notice the sign, all you need to do is to speak with your doctor or seek useful help as soon as possible. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with all mothers out there and also all fathers so they understand that something is wrong that needs to be acted upon quickly. It is not witchcraft, it is not laziness on the part of the mother. It is just some hormone doing some dangling things in the woman's body, or it could be as a risk factor, as a result of the risk factor, which I already listed. Thank you very much and see you in our next video. Bye.